I'm Yamina. I'm going to be your nurse for today. Can you tell me your name and your date of birth?
Tawana Whitaker, 6/23/62.
All right, Miss Whitaker, I've went ahead and cleaned my hands. I'm going to be doing an assessment on your abdomen today. I'm just going to start off by just inspecting your abdomen. I'm just going to inspect for your color. Your color of your abdomen is brown, which matches the rest of your skin tone. Your shape here, you have a nice flat abdomen. I don't see anywhere where your abdomen is protruding. Just looking at your abdomen, I don't see any pulsations. I can see when you breathe, your abdomen rises just slightly when you breathe. I do see some striations on the left side of your abdomen and also on the right side of your abdomen. Not so much at the lower quadrants of your abdomen, but definitely on the left and the right quadrant. Let's see, your umbilicus is inward, is not protruding outward. It's midline in your abdomen in the middle there. Your abdomen looks very symmetrical on the left and the right side. I don't see any abnormalities. All right, I was just looking at your breathing. That's fine. I don't see any type of peristaltic waves. So everything as far as the inspection portion looks good. Now what I'm going to do, I'm going to go ahead and auscultate your abdomen. I'm going to listen in your all four quadrants, your upper left, right, lower left, and your lower right. And I'm also going to be listening for some vascular sounds and some bruits over certain parts of your abdomen. But I'm going to go ahead and start listening to your quadrants, and I'm going to use my diaphragm. I'm going to start off by listening in the right upper quadrant. Moving down to the right lower quadrant. Over to the left lower quadrant. And to the upper left quadrant. I was able to auscultate sounds in all four quadrants, indicating that you do have active bowel sounds. I'm going to also just listen with my bell momentarily. All right, I'm going to also listen over your spleen and also over your liver. I'm going to be using my diaphragm and my bell, and I'm going to go ahead and I'm going to start with your spleen on the right side of your abdomen. Switching over to the bell. I'm going to move over to your left side and listen over your liver. First with my diaphragm. Now with my bell. And with my bell, I am able to just hear more bowel sounds in that area. I'm going to also go ahead and listen over your aorta using my bell. So I'm going to be listening just above your umbilicus. And now I will listen with my diaphragm over your aorta. All right, I was just listening for any type of abnormalities. I was listening for bruits. I didn't hear any bruits, so that's a very good finding. And I didn't hear anything that was out of the ordinary. I might have heard a few vowel sounds here and there, but that's about it. I'm going to go ahead and auscultate over your iliac arteries and then also over your renal arteries. And I'm going to use my bell for that. Take some deep breaths for me. All right, I'm going to re-listen with my diaphragm. All right, no adventitious sounds heard over those arteries. I'm also going to go ahead and listen for your femoral arteries. So I'm going to move just a little bit below your stomach here. I'm going to use my bell and my diaphragm to listen to those arteries, just checking for bruits and any type of vascular sounds. And there again, I don't hear anything out of the ordinary. I don't hear any bruits. I don't hear any sounds that are alarming to me. All right. At this point, I'm going to go ahead and start to do some percussion. So I'm going to use my non-dominant hand, which is my right hand. I'm going to place it on your abdomen, and I'm going to use my dominant hand, which is my left hand. I'm going to take my middle finger and strike the middle finger on my left hand over all 4 quadrants of your abdomen. I'm going to be listening for tympanic sounds. All right, so I'm just going to start with the upper left quadrant. Moving over to the right quadrant. And all those sounds do sound tympanic. I didn't really hear any dullness, so that's good. All right, now I'm going to go ahead and percuss over your spleen. And so I'm going to be moving over here to the right side. I'm just going to pull your shirt up a little bit here. I'm sorry, I'm going to go ahead and percuss your liver over here. So I'm going to use the same technique, and I'm just going to percuss upward until I go from a tympanic sound to a dull sound. All right, so it's dull at about right there, so I'm just going to mark that. I'm just going to do one more check just for my satisfaction. Okay, I'm going to remark that. I think it got dull a little sooner than I thought it did. Okay. So I'm just going to measure that point of where I started, where it was tympanic to where it became dull, and see how many centimeters that is. So it looks like it's about 5 centimeters in between the dull sound and the tympanic sound, which that is in normal ranges. All right. So now I'm going to go ahead and try to percuss your spleen here. So I'm going to move over to the right side, and I'm going to come down to about the 10th intercostal space. So I will be feeling over here on your ribs. Let me know if any of this bothers you. Okay. All right, and I do hear tympanic sounds as I percuss on the left side over your spleen. So now I'm going to go ahead and I'm going to percuss your kidneys for tenderness. So I'll be percussing on the left and the right side. I'm sorry, I'm going to go ahead and palpitate all 4 quadrants. It's going to be a light palpitation, okay? I'm going to start over here on the left side, which is closest to me in the upper right quadrant. All right, moving over to the right lower quad. All right, I don't see any swelling. I don't feel any masses, so that is good. All right. I'm going to go ahead and palpitate over the aorta here in the midline portion of your abdomen. And there again, I don't feel anything hard. I don't feel any masses. Everything feels soft. Are you feeling any tenderness? No. Okay, very good. All right, I'm going to go ahead and move over here to your right side and percuss and palpitate your spleen. Just light palpitations here. All right. I'm just going to palpitate your liver. Okay. And I'm going to also palpitate your bladder, okay, just to see if there's any distension. And I feel like you've recently emptied your bladder. I don't feel any distension there. Okay, now I'm going to do a deep palpitation. So I'm going to go ahead and I'm going to palpitate your spleen first here on your left side. Okay, so I'm going to just come right over here above your rib cage. I'm just going to push down a little deeper. Let me know if any of this bothers you. Does that cause you any pain?
No.
Okay, and I cannot palpitate your spleen. It just feels very soft. I don't feel any masses, no resistance. That is a normal finding. I'm going to move over here to your right side and palpitate for your liver. It's going to be a deep palpitation. And again, I don't feel anything abnormal. I don't feel any masses at all. I just feel a soft abdomen. Okay. All right. During that deep palpitation, did you have any tenderness?
No.
Okay, do me a favor. I'm going to palpitate again, but this time I want you to take deep breaths in and out as I palpitate, okay? And I'm going to start over here on the left side. You can go right ahead. Moving to the right side. Coming back over to the left. In the middle. All right. Did you feel any tenderness or discomfort with that palpitation?
No.
No. Okay. So I don't see any type of rebound tenderness. So this, Ms. Whitaker, will complete the assessment of your abdomen. Thank you very much.